Hello, I'm Gayle Smith. I'm the Executive Director of Quality Planning and Innovation at Eastern Health and also the Chief Allied Health Officer. So in my role I have responsibility for the quality management systems, the patient experience of care program, the strategy planning and risk management portfolios, and also the continuous improvement program. So our vision is really about putting patients at the centre of everything that we do, and our vision statement is great care everywhere, every time. And more particularly, we also have a set of values that really drive the organisational culture and performance around patient focused, with our primary value being patients first. Once we started to look at what it was that patients were and their families were telling us, we started to really understand that the biggest issue was about communication. And people told us a lot about communication. They told us when we got it right that they were really delighted with the service. And they told us when we got it wrong that they were disappointed with our service. I think the other thing that we learned was that we have terrific staff who by far the majority of the time, well over 90% of the time, deliver a service that patients and their families are happy with. But we don't always get it right. And for every patient, we don't always get it right all of the time. So some patients would tell us, look, everything was terrific except for this one experience that I had. And that can have been over a stay of, either 4 hours or 4 weeks. But that one experience that didn't go well really stays with the patient and the family. We also know when we get our complaints, often it's because multiple things went wrong for that patient and their family. And it's the cascading effect of multiple things going wrong that is problematic for them. I think that there's a difference between actively managing and effectively managing a complaint for a patient and their family compared to organisational learning around how we can consistently provide a great experience for patients and families. I compare it to learning from incidents. If an incident happens and harm occurs to a patient, we need to address that and make sure that that harm is addressed. And then we need to look at the systems issues that occurred to make sure that they don't happen again and the same harm is not experienced by another patient. This is the same. If a patient has had a bad experience, we need to understand what that was and why that happened. We need to apologise for that poor experience, and we need to address it with the patient and family to the extent that we can. And that needs to occur with the staff who have been providing that service. We then need to take the information from that and I think aggregate it, triangulate it, and understand what is it about our systems that are making it difficult for our staff to be able to provide the standard of care that we want them to provide for every patient every time. We know that our staff come to work every day to do a great job, and we know that we have really terrific staff and that they're our greatest asset. And what we need to be able to do is to better understand how we can help people to give a great experience every time. We need to be able to understand about team dynamics. We need to be able to understand about interpersonal issues. We need to be able to understand about personal issues and how they impact on people providing care at any time. That's the complexity of this. I think if all it took was to say we want to provide great service for people to do it every time, it would be easy. But the complexity of the work that people are needing to do, I think is the challenge for us in really understanding this work. My advice would be this takes time. It takes a long time to build this culture. We're now at the point of understanding that the only way we can really consistently improve the service is for the frontline teams who are working with the patients to actually take ownership of those issues and manage it themselves. So we're really looking at a model where we can start to get teams to come together, it's interdisciplinary teams, to come together to work at what does a great experience for their area look like. So a great experience in the emergency department will not be the same as the great experience in ICU, and it won't be the same as a great experience in our rehab unit, because the care requirements and the patient presentations and the family requirements are actually different in those care settings. So we need to be able to work with areas to build their own model of care, to then work out how they can support their teams to consistently deliver that model of care. So just getting to the issue of measurement, I think that this is the area that is really proving the most challenging for us. We know that we've got a lot of qualitative data and we can translate that into percentage scores, but we're just not yet convinced about how valid and reliable our tools are for collecting this information, and we're not sure about when we see a change in performance, whether or not it's statistically significant. Now, I know for quality improvement, we need to be taking the data as it is, but at the moment, the data raises more questions for us than provides answers, and I think it's a really interesting space for us. We look at the VES score and the overall patient experience score, and obviously the statewide target's 95%. We range somewhere between 92 and 94%. We benchmark well against our peers, but we don't consistently meet the statewide target. So we've had a look at that and tried to understand what it would take to get us to that target consistently. But that hasn't really provided us with a helpful way to deploy an improvement process and get local ownership. So I think we're continuing really to try and search for how we can get some quantitative measures that are really going to help us with our improvement program. When we got to that patients and their families really valued courtesy and kindness, we started to try and think about, well, what do you do about courtesy and kindness? What does it take to make people more courteous and more kind? And when we went and talked to the staff and watched the staff, we could see that that they were always trying to be courteous and kind, but sometimes they didn't see their own behaviour. And I had an instance where I was in outpatients, a patient who was waiting came and asked one of the clerks about how long they need to wait for their appointment because they needed to go back to work. And the clerk said, well, we can't, this is an outpatient clinic. You should have known you'd be here all day and you should probably have taken a sick leave day. And I thought, gosh, that's, an unusual sort of response. Not what I would have thought would have been particularly a kind and courteous response. And I said to the staff member, do you get those sorts of questions often? And she said, yes, we get them all the time. And I said, so how have you agreed that that's the response that you're going to give? She said, well, nobody ever told me what to do. She said, I'm relatively new here, so I just watched what other people did, and that's what I did. And I thought, gosh, that's what you observe. So have we armed people to be able to give them the right response? How would they know when they get asked questions like that, which they tell us they get asked all the time? How have we helped our staff to be able to give the right response? And actually where we ended up was looking at how could we start to have conversations with our staff about values, attitude and behaviour, because that's what culture is. And that really led us to be looking at how can we use our values in our organisation to start to drive the sorts of behaviours that we really want to be able to see. I think you have to start with strategy, and I think you have to start with strategic intent, and I think you have to start with how do you bring the values to... First of all, have you got the right values? Big question. Are the values that you've got going to help you deliver the sort of culture that you want? You look at values from most organisations and nobody can really ever debate that those are really good values to have. But are they really targeted enough to enable you to deliver the sort of service that you want? I was just reading some information from some of the high-performing health services around, in other parts of the world, and interested to see that some of them only have 3 values. Now we think we have to write everything down, that it's, but actually really being targeted about your values and how they're going to drive the behaviour that you want to see and how that's going to build the culture that you want, I think is the really critical point. So what's next for Eastern Health is keep going. We have got what we're calling our Patients First program, which has really come out of our new strategy and our primary value around Patients First. Our next step is how do we get more patient engagement in co-production and co-design of our models of care, and how are we going to be able to do that. And then also I'm really interested to understand how we're going to be able to deploy it and get local ownership of providing a great care everywhere, every time by the local teams. For us working in administration and hospital management and hospital health service leadership, we can do lots of work around building the right culture, but the only people that can deliver it are the people who, right now as we're filming this, are out there working with patients and families delivering the services. And they're the ones that we need to support to be able to do this work. They absolutely own it. It's their job, and I think, if I leave one message, that's the message. We have to get that local ownership and engagement.